Hello, and welcome Dr. Genie Heitmiller. She's a professor and chair at DC National Children's Hospital. I am so fortunate to have had her as a friend, a colleague, a mentor. And for those of us who may not know you very well, can you please give me a little summary about yourself?
Oh, sure. I'm the chief of anesthesiology, pain and perioperative medicine. So I am personally, I'm a wife, a mother, a grandmother. I guess towards the end of my peds residency, having done the surgery rotations and the ICU rotations, I was watching them bring kids back from the cardiac ICU, and I said, that's what I want to do. And so then I did an anesthesia residency, and then I did cardiac and pediatric fellowships, not ACGME at the time, but fellowships nonetheless, and then stayed on at Hopkins for the majority of my career as a pediatric and cardiac anesthesiologist, and then came to DC to be at Children's National.
Having been on both sides of the mentor-mentee relationship, what advice would you give mentees on how to take the most advantage of the mentor or sponsor?
So, I always say that it's probably 90% mentee and 10% mentor when it comes to the effort.
Mm-hmm.
And I think people who are very successful with the mentor-mentee or mentee-mentor relationship are those who, they come and find you, they are in, regular communication with you, and it's not, the mentor is not going to go out and find the mentee and tell them what to do. I mean, that's, I hope, pretty clear for mentees. The mentor is there to guide you, to help you out when you can't, with decisions or finding resources or networking. They're not going to give you the passion to do something. Mm-hmm. They're not going to do the work for you. Okay. They're not going to write your paper. They're not going to do your research, but they're going to be there to help you with the different pieces. Mm-hmm. I think that's the most important message I would want to get through.
Mm-hmm. And for a mentor, what advice would you give a mentor so that they can provide their mentee the most beneficial experience or sponsorship?
I think if you really want to have a formal mentor-mentee relationship, you probably should have a formal meeting set up, like on a particular day at a particular time every month for a half an hour or an hour, keeping your finger out there on the pulse of the mentee to make sure that they're doing okay.
Who's been the most influential mentor for you?
Well, I would probably have to say Myron Yaster has really pushed me the hardest of anybody. Mm-hmm. And gotten me the most as far as networking and ideas and resources. Peter Carnivos was also great as far as networking and resources and guiding me in the quality improvement side of things. Mm-hmm. I've had a lot of people in my life, I have to admit, but I probably can't even name them all.
At the SPA virtual conference, your talk, that at one point you had to take a leap of faith and change a little bit your pursuits from cardiac anesthesia to more outpatient anesthesia care. And how did you justify that decision to yourself and your family?
Well, so that happened because of my family, actually. Mm-hmm. So I was doing cardiac, and I was running the main operating rooms at Hopkins, and the amount of time and that was required for that far exceeded what my family needed. I mean, like, it far exceeded what I was able to give my family. And I guess you saw that little clip when I said, my kids were asking my husband why he didn't marry the babysitter, right? You saw that. So that was sort of my turning point. I said, okay, well, I have to give this up now. I don't have to give up my career entirely. I can still do the thing I love, which is taking care of pediatric patients and administering anesthesia. I just have to do it in a different venue on a different, a different schedule. So, and the outpatient center allowed me to do that. It was more of a regular schedule. They allowed me to do this with, taking call from home. I didn't have to take in-house call. It was just a lot of different, it was a little bit different. And it was, I took a cut in pay. It was fine. I didn't care, but I wanted to continue what I was doing. I just didn't do it every day. I had I kind of just backed off. I was packed part-time for a while. It was just a couple of years. But my family needed that.
How did you grow as a leader from having had that experience?
Well, I think that when I'm much more empathetic, whether it be a man or a woman comes to me and says, I'm having a real hard time balancing my family and my work. And I sometimes will tell them my story. I'll say, I had to step down I was on my way up the ladder and I had to step down for a little while. And it's okay. You can stop for a little while and pick up your career and move on. It's all doable. But your family is very important. And before you know it, they're all grown up and gone, and you don't want to miss that. So
I think that's something that's really helpful to hear, because I think many people experience that and they feel like, oh, my career is going to be down the tubes if I do this. Or they just need to be reminded, that you can't, not everything can be number one, and you do,
you can prioritize things, and you can work it out so that you don't have to give up everything. You can still have keep your hand in the pie. You just don't keep it as deep in. That's right.
Yeah.
You can still do it.
Yeah.
We're very lucky. I actually looked for another job for a short time, thinking that they would never let me do that at Hopkins. But it turns out all you got to do is ask, and then I was able to. It wasn't all or none. And I think there's less and less of the all or none these days. If as long as you're willing to take reduce your salary, or somehow it can work out.
Right. Something it's a give and take. So you have to figure out how to accommodate your situation. So,
and it's good to and so negotiation skills sometimes come into, depending on where you are. If it is a little bit more difficult, you can negotiate. Look, I can give you all of this if I can. It's usually just finding out what each party needs.
Being a woman gives us a unique view of the world. Any closing remarks on your experience as a female anesthesiologist?
Enjoy what you do. Make sure if you it's the old story. If you enjoy your work, you'll never, if you enjoy what you do, you'll never work a day in your life, kind of thing. And I really love what I do, and I wouldn't change it for anything.